guys, it's me, Professor D, and welcome back to my channel. On this video, I want to cover the nursing process and critical thinking. And guys, this is what all of your test questions are based on. So that's what I'm going to be covering in this video. If you have not done so already, please be sure to press that like and subscribe button below. That will keep those videos and the content going. So let's just jump right into it. First question. The nurse decides to administer tablets of Tylenol instead of the intramuscular Demerol she has previously been providing her orthopedic client. Which step of the nursing process does this address? 1. Assessment. 2. Nursing diagnosis. 3. Planning. Or 4. Implementation. And I'll give you a moment to think about your answer. And guys, the correct answer is 4, implementation. Whenever a nurse is performing an action, she's doing something, that is implementation. Remember ADPIE, A-D-P-I-E. A is your assessment. Assessment is gathering information. Anything that gets you information, whether that's doing a physical assessment, looking at the patient, whether it's going through the chart to get information, asking the patient a question or family members a question, anything that gives you information, that is part of the assessment. 2, nursing diagnosis. Guys, nursing diagnosis is based on the medical diagnosis. So let me give you an example. If the patient has a medical diagnosis of asthma, okay? The nursing diagnosis is the patient's reaction to the medical diagnosis. So the patient has asthma, your nursing diagnosis can be impaired gas exchange, okay? Your nursing diagnosis is always going to be the patient's reaction to the medical diagnosis. Then you have 3, planning. Planning is deciding what you're going to do for that patient, what you want the goals for that patient to be, what you want the outcome to be. That is planning. And then of course, implementation, which I explained to you already. Implementation is the action, what the nurse is doing for the patient. Next question. The nurse has multiple client assignments on the surgical unit. On beginning the shift, the nurse needs to determine which post-operative client should be seen first. Of the following, the nurse should go to see the client who, 1, has a documented blood pressure of 90/50, 2, was medicated for back pain 10 minutes ago, 3, has an order to be out of bed and ambulated, or 4, requires instructions for wound care before discharge. And I'll give you a moment to think about your answer. And guys, the correct answer is 1, that patient that has a blood pressure of 90/50. Please, if you have not already watched my video on priority, make sure you watch that. The priority video covers which patients you have to see first, who's, I don't want to say most important, but which patient is going to be a priority. And number 1 is an example of that priority patient, okay? 90/50, that blood pressure is too low, okay? And patient's blood pressure is part of what? Physiologic integrity. Remember, anything that affects the patient's physiologic integrity, they're who you're going to be running to first, because physiologic integrity is what's keeping that patient alive. Blood pressure, fluid and electrolytes, nutrition, airway, breathing, circulation, the list goes on. Make sure you guys watch that video if you feel like you don't know the priority patients too well. So number 1, that blood pressure 90/50, that's who you're running to. And they even gave you a hint. In the question, they told you the patient just came from surgery. Let me explain to you. Any patient that comes from surgery, you have 3 concerns that you're gonna be watching out for the most. Number 1, bleeding. That patient hemorrhaging out. Guess what? That blood pressure of 90/50, possibly that patient can be bleeding. That's why their blood pressure is going down, okay? What else are we worried about a post-op patient besides bleeding? Infection. We're going to be looking at those WBCs. We're going to be watching out for signs and symptoms of infection. And the third concern, any patient who had surgery, we're concerned about them developing clots, DVTs, right? That's why it's so important for us to get that patient out of bed, We want them to have circulation. We want blood moving so they don't get DVT, okay? So infection, bleeding, and DVT are 3 biggest concerns for patients that just had surgery. Next question. Which of the following is the best example of a nurse's use of reflection? 1, the nurse places a client experiencing respiratory difficulties in a high Fowler's position. 2, the nurse calls the provider when the client reports feeling chilled and achy while having an oral temperature of 100.2. 3, while caring for a client with a history of asthma, the nurse assesses the client's pulse ox reading when he doesn't sound right. Or 4, a nurse tells the client, when you refused to go to physical therapy earlier today, I believe you were upset about something else besides the appointment time. I'll give you a moment to think about your answer. And the correct answer is 4. Reflection, guys, is when you go back to a moment in time, you repeat to a patient something that happened, and you allow them that time to think about it and to answer. So the patient's reflecting about something that happened earlier. The patient was upset earlier, and the nurse is noting, hey, I noticed you were upset earlier, but it kind of seemed like you're upset about something else. And the nurse is quiet. Being quiet, that time of quiet, that's a form of therapeutic communication, because you're allowing that patient time to kind of think about their feelings and to verbalize an answer. So number 4 is the correct answer. When you're thinking back, when you're going thinking back to get a deeper understanding, that's what reflection is. Next question. Which of the following nursing situations best reflects accountability? 1, the nurse takes oncology nursing certification exam. 2, the nurse files an incident report regarding a medication error. 3, the nurse assesses the client for possible cause of his pain. 4, the nurse tells the client, I don't know, but I will find out for you. And the correct answer is 2, the nurse files an incident report regarding medication error. That is that nurse taking accountability for their actions. They're taking responsibility, okay? Now, let me talk to you guys about incident reports, because there's a couple things that are very important that you guys have to know. Number 1, the incident report never, ever, look at me in my eyeballs while I tell you this so you can understand and never forget, never goes in the patient's chart. Do you hear me? Incident report is for the facility, okay? It goes in a different book. It's for the facility so that they can know what the mistake was, and they can start creating measures so it doesn't happen again, okay? An incident report should never even be mentioned in the patient's chart, okay? You guys follow me? Because I promise that's going to be a test question, so make sure you guys understand that. So incident report, that's the patient the nurse being accountable for her actions. But something very important you have to remember about the incident report, it's for the facility. It does not go into the patient's chart, and I cannot stress that enough. Next question. Which of the following nursing actions is the best example of problem solving? 1, requesting an IV team to start an antibiotic drip on a client with a history of being a difficult stick. 2, offering to call the kitchen to provide an alternate breakfast for a client who does not like cooked cereal. 3, trying several different wound dressings to determine which one the client can apply the most effectively. Or 4, calling for another pain medication order when the current drug results in the client experiencing nausea. Let me reread that because it sounded weird. Number 4, calling for another pain medication order when the current drug results in the client experiencing nausea. And I'll give you a moment to think about your answer. And the correct answer is 3, trying several different wound dressings to determine which one the client can apply most effectively. Problem solving is trying different things to figure out what works and then using what works. So that's what problem solving is. You don't pass the buck, you pass it on to somebody else to do your job for you. Problem solving is trying. You keep trying different things to see which one works, and you stick to what works. Next question. Which of the following nursing interventions is the best example of the implementation step of the nursing process? 1. Determining the client's ankle edema is worse after he ambulates. 2. Asking the client to rate his ankle pain after receiving oral pain medication. 3. Arranging for the client to receive pain medication 30 minutes before his ordered ambulation. Or 4. Crushing the client's pain medication to facilitate easier swallowing and thus minimize the risk for choking. And the correct answer is 4, crushing the client's pain medication. Remember, as I told you guys before, implementation is action. That's what you're doing for the patient. If you guys take a look at number 1 and 2, determining, asking, those are what? Assessment. Anything that gathers information for you is part of the assessment. Number 3, arranging for the client to receive pain medication. That's planning. You're planning what you're going to do for that patient. So number 4, crushing, that's the action. You're actually doing something for the patient, and that is what implementation is. Next question. A clinical nursing instructor asked the nursing student to describe a critical thinker. Which of the following represents the best response? 1, a person with the educational background to solve problems. 2, a person who finds the problem and does what it takes to fix it. 3, it's someone who uses a scientific method to solve problems. Or 4, someone who uses a system to work through and solve a problem. And the correct answer is 2, a person who finds the problem and does what is best to fix it, right? And as nurses, how do we do that? ADPI, okay? The first thing we do is assess. We get information to find out what is going on with that patient. Then we come up with our nursing diagnosis. We use the information from the assessment to figure out what is wrong. How is the body reacting to the medical diagnosis? Then is your P, planning. What is our outcome? What do we want to see happen with this patient? What are our goals for this patient, right? Then you have your I, implementation. Actually carrying out the plan. That's the action. What are you doing for this patient that was based on your plan? And then finally, E, evaluation. Whatever you do, whatever your implementation is, you always have to go back and see if it worked. Because if it worked, great, we're going to keep monitoring the patient. But if it didn't work, you're going right back to A, assessment, and you're starting all over again, okay? So that's why the correct answer is 2, a person who finds the problem and does what is best to fix it. And our very last question. Which of the following statements made by a nurse regarding a personal reflection related to client care requires follow-up by the unit's nurse manager? 1, Mary and I were comparing foot wound dressing techniques. 2, I've been caring for orthopedic clients for 10 years and I think I've seen it all. 3, I can't believe that my client isn't improving after 2 weeks of physical therapy. 4, I always wean my orthopedic surgery clients onto oral pain medications on post-op day number 4. And I'll give you a moment to think about your answer. And guys, the correct answer is 4 because what they're asking us is which one is wrong. And number 4 is wrong. I always wean my orthopedic surgery clients. Well, guys, if you guys don't understand why I just said always, make sure you watch my video on how to answer questions that you have no idea what the answers are, okay? And I'll just give you a little snippet. You stay away from those answers that say always, never, only. Those all-inclusive answers you stay away from. Those are usually wrong. And this question is asking us which one is wrong, and it's number 4. The nurse says that she always medicates her patients on, weans her patients off of the medications on day 4. Here's the problem with that. Everybody's not the same. One person's body reacts differently than another person's body. So you're not supposed to always do the same thing. That's why we have the nursing process. That's why you have to assess your patient, right? Because the information you get from that assessment, maybe that patient needs to be weaned off on day 2 instead of day 4. Maybe that patient needs to be weaned off day 6 instead of day 4. You're not going to know that unless you follow the nursing process, which starts by assessment. So that's why that's the wrong answer. You don't treat all your patients the same. Absolutely not. Guys, make sure you watch that video on how to answer nursing questions if you have no clue what the answer is. It's very informative and I believe it's going to help you. I hope this video was helpful to you. If it was, please be sure to leave a comment and also comment on any content that you'd like me to cover and clarify for you. Please do not forget to press that like and subscribe button. Thank you so much for joining me, and I'll see you next time.